Burke's patient, Kalpana Vera.
Kalpana, named by villagers in Nepal.
She presents with multiple syncopal episodes and ventricular arrhythmia.
So you've been passing out?
Yeah, and having palpitations.
Past medical history of rheumatic heart disease with mitral valve stenosis.
They had to ship me from Zambia to the States for 3 months of treatment when I was 8. Rheumatic fever almost killed me.
Dr. Stevens, what are the primary causes of ventricular arrhythmias?
Valvular disease, mitral valve prolapse, stimulants, drugs, and metabolic abnormalities.
Scrub nurse to OR6.
What? Out.
I saw that. I saw you take that pill.
Oh, it's my pill, you know, the pill.
It's not in your chart, and you're supposed to tell us all the meds you're on.
You're not my doctor. You shouldn't even be here.
She's right. You shouldn't be here.
I saw her take unauthorized medication.
I'm on the pill. And I had grapefruit juice this morning. Since the juice inhibits enzymes involved in the metabolism of OCPs, I thought I'd avoid the interaction by taking it 2 hours after my meal.
She has a doctorate in neuropharmacology, Christina.
Well, Izzy, I don't see oral contraceptives.
Okay, well, now you will. Would you just go back to bed and stop trying to poach my patients?
This
is ridiculous. It's now. Could you just go back to bed and stop poaching my patients? It's not a...
She's in BFib. Call the code.
Gold blue, second floor. Second floor.
No code?
Not anymore. Can you help us get her back into bed?
I'll help. Just give me a minute.
Would you just go back to bed? Please, seriously, go.
Oh, God. You know, Izzy, if she's on OCPs, we mark it down, okay?
Yeah.
You scared us a little there. How's the workup coming?
Electrolytes are within normal limits. Urine tox was negative and EKG's fine. TIL test is scheduled for noon. Oh, and she's on contraceptives.
So?
That's what I said. Other doctor made such a big deal of it.
She didn't tell us before, so I documented it in her med list.
What other doctor?
Christina, she was wandering the halls.
Fine. Take her down for an echo.
An echo? What about cardioversion or ablation? Won't I need a pacemaker or a permanent internal defibrillator?
Although it would be unusual for rheumatic heart disease to cause ventricular dysrhythmias, we still got to check your valves.
I thought your doctorate was in neuropharmacology, not medicine.
It is.
It's odd.
It's odd that I'm not jealous.
No, you have every right to be jealous. It's your territory, and she's peeing all over it. What's odd is Burke's patient. She's been in 4 other hospitals this year. You know, something's not right. Hey, Izzy, how have her studies?
Hey, I have been looking for that everywhere.
Negative, right?
Oh, the echo test showed mild mitral stenosis. The TIL test was negative. We're doing EP studies.
I can tell you what's wrong with her without sticking electrodes in her heart.
Really? Just by the chart?
No, from the pill she took.
They were contraceptives, Christina. Why are you so obsessed with this? Just go back to bed.
I think she's doing this to herself.
You think she's inducing ventricular arrhythmias? She'd have to be crazy.
Something that is very real. Lucy Polkinghorne has more.
Completely lost full ability to walk.
I rely on everyone to help me get food, get change, help drown myself out of the shower because I can't do it.
Very frightening. You just see your child go from a perfectly active teenager to not being able to walk, not being able to talk.
It's very hard, I think, for people to understand, for laymen, for anyone to really understand how it can be that patients can present with such significant, overwhelming symptoms when there's no physical cause.
Incredibly, doctors say there shouldn't be anything wrong with Adelaide teenager Holly Longford.
I was spasming out of control and I couldn't stand or walk. But as I got in for longer, I started to lose my speech.
16-year-old Holly has been living a nightmare existence for over a year.
It was really frightening having all these tests done and each test coming back negative for everything.
What did you think was happening to you?
I just thought something's really wrong with me, but what it is, I don't know what it is. And is it like, could it kill me?
Up until then, she was like any other school-going teen.
Going out with friends to parties, I played netball, touch footy, and I danced.
But her world was turned upside down 14 months ago after a collision while playing netball.
And I came off the court crying because my back was in so much pain. And then the days progressed, I just got worse.
She saw chiropractors, physios and doctors, but no one could help.
I got admitted to another doctor, and then he put me on fluoxetine, and I had a reaction to it. So it sent my body off into a spasming seizure sort of thing, not being able to stop, and I couldn't walk at all.
She spent 2 weeks in hospital learning how to walk again. And despite countless tests and scans, doctors couldn't find anything physically wrong. For her mum, Wendy, the unknown was frightening.
You just see your little girl deteriorate and they can't find anything. And I suppose that's the hard thing as a parent. You don't want to believe it's a psychological issue either, because you think, I can't fix that.
No one really understood it as well. They just thought it was like just a freak case and like almost a miracle that I recovered so quick.
But not for long. The spasming in the legs returned and she was readmitted to hospital. And that's when she was diagnosed with...
Is a disorder where patients present with signs and symptoms of a neurological illness, such as having had a stroke or a seizure of some description, but where there's no actual underlying physical illness. Instead, it's the body's response to some underlying stress.
Edition with new information on that mom from Mingo County who's accused of injecting a substance into her 9-year-old son's IV. He was being treated at a hospital in Cincinnati when this happened.
Well, today a grand jury indicted Candy Flutie on 4 felony counts for knowingly causing serious physical harm to her son by injecting that substance into the IV. Brad Myers joins us now. And Brad, today we learned some very disturbing details of what Flutie is accused of actually injecting into her own son.
Yeah, Tim, prosecutors say Candy Flutie used a syringe to inject feces into her son Elijah's IV while he was receiving treatment at the hospital a few weeks ago. Prosecutors now suspect Flutie could suffer from a rare mental disorder that often goes overlooked.
A little more than a week after being arrested at Cincinnati Children's Hospital, a grand jury in Hamilton County, Ohio, has indicted Candy Flutie on 4 felony counts, including 2 counts of felonious assault. Prosecutors say during a hospital visit earlier this month, Flutie used a syringe to inject fecal matter into her son Elijah's IV.
She put it into his IV, and when she does this, his fever spikes, as you would expect. Again, we're just thankful that the hospital caught this before the child was killed. We don't believe her intent was to kill the child. We believe her intent was to make him sick, and she succeeded in that.
Hamilton County prosecutor Joseph Dieter says Flutie was under video surveillance for the past year after hospital officials suspected she was tampering with her son's care.
Things were not making sense to them. When he's been there before, some of the IV lines had been broken and things like that.
Family members say Elijah has spent most of his life in and out of hospitals battling Hirschsprung disease, which affects the colon. Prosecutors now suspect Elijah's illness may have been exaggerated or intensified by Candy Flutie.
She was getting money from people who felt on Facebook, from people who were trying to help the child. You know, she was getting a lot of attention for this. They have every right to put a camera in their rooms for security purposes, and they caught her.
Prosecutors say it sounds bizarre that a mother could do this, but they say while rare, they actually have seen similar cases even in the Cincinnati area. Flutie's son Elijah is now in custody of West Virginia Children's Services. We're told he's staying with a relative. Candy Flutie is free on $50,000 bond. She's set to be back in court next week in Cincinnati. Tim, if convicted of all 4 felony charges against her, she could spend 8 years in prison.
All right. Hey, thanks, Brad. And prosecutors also say after injecting her son with feces, Flutie took a picture of her son and then posted it on Facebook saying he was very ill.
So what's the problem this time?
This time I really think I have something. I mean, I'm absolutely convinced of it. You know, I mean, it's not like that adenoidal thing, you know, where I didn't realize I had them out. But it was when I was younger. So.
No, I saw your father this week about his sinus, and he complained of chest pains.
Well,
you mentioned on the phone that you'd had some dizziness.
yes, a little dizziness, and I think I'm developing a hearing loss in my right ear. Oh, my left ear. My left ear. No, I'm sorry. It was my right or my left ear. Now I can't remember.
Okay, let's take a look. Well, I'm sorry to say you have had a significant drop in the high decibel range of your right ear.
Really?
You've been exposed to a loud noise recently, or have you had a virus?
No, I've been perfectly healthy. You know me. I always imagine that I have things.
When did you first notice this?
Well, about a month ago. What do I have?
You've had some dizzy spells. What about ringing, buzzing? You notice any of that?
Yes. Now that you mention it, I have buzzing and also ringing and buzzing. Am I going deaf or something?
And it's just in one ear.
Yes. Is it healthier to have problems in both ears?
Nicky, what's the matter with you? You're all white.
I feel dizzy. You know, I don't feel well. Do you hear a ringing? Is there a ringing sound?
Yeah. I hear it.
No,
Hello?
not that.
Yeah. We're gonna be working late tonight. No, we'll order out. It's all right. Yeah.
If I have a brain tumor, I don't know what I'm gonna do.
Don't have a brain tumor. He didn't say you had a brain tumor.
No, naturally they're not gonna tell you because sometimes the weaker ones will panic if you tell them.
But not you.
Oh God, you're a buzzing. Is there a buzzing?
Nicky, come on, we got a show to do.
I can't keep my mind on the show.
But there's nothing wrong with you.
If there's nothing wrong with me, then why does he want me to come back for tests?
He has to rule out certain things.
Like what?
I don't know. Cancer.
Don't say that. I don't want to hear that word. Don't mention that while I'm in the building.
But you don't have any symptoms?
I got the classic symptoms of a brain tumor.
2 months ago, you thought you had a malignant melanoma.
Naturally, I had the sudden appearance of a black spot on my back.
It was on your shirt.
How was I to know? Everyone was pointing back here.
Come on, we've got to make some booking decisions.
I can't think of it. He didn't say you had anything. He just doesn't like the spot on your x-ray, that's all. Doesn't mean you have anything. Don't jump to conclusions. Nothing's gonna happen to you. You're in the middle of New York City. This is your town. You're surrounded by people and traffic and restaurants. God, how can you just one day vanish? Keep calm. You're gonna be okay. Don't panic. I'm dying. I know it. There's a spot on my lungs. All right, now take it easy, will you? It's not on your lungs. It's on your ear. It's the same thing, isn't it? Oh, jeez, I can't sleep. Oh, God, there's a tumor in my head the size of a basketball. Now I keep thinking I can feel it every time I blink. Oh, Jesus. He wants me to do a brain scan to confirm what he already suspects. Look, I'll make a deal with God. Let it just be my ear, okay? I'll go deaf and blind in one eye, maybe. But I don't want a brain operation. Once they go into my skull, I'll wind up like the guy with the wool cap who delivers for the florist. Relax, will you? Your whole life you run to doctors. The news is always fine. That's not true. What about years ago?